we want people to educate their patients. So what we're going to do is we're going to provide you the opportunities and the tools to be a dentist, obviously, but we're going to also provide you the tools to be an educator. So, I went to, about a year and a half ago, I went to a doctor's appointment with my brother, and he was diagnosed with type 2 diabetes. And I was really appalled because the doctor did not tell him that he should be eating better, exercising, taking better care of himself. He just prescribed him meds. Okay? Now, but it goes across the medical and the dental side as well. As a dentist, we're going to train you to educate people how to better take care of themselves, how to make sure that their dental hygiene is the way it should be. And I've went to dentists where they haven't done that either. And so it's really important for us. Orthodontic residency, this is a post-dental degree where we have a very small select group of students who can go through an orthodontics residency and get certified in that. I want to talk about, before I get into this, the underserved population. This is a little bit different PowerPoint. We just updated it. So underserved populations are extremely important. I mentioned why we started the two schools. We want to make sure that, and the students when they graduate with their degree, they are free to do what they want. They're dentists. They can go and they can serve wherever. But we hope that we're going to train them to really try to make a difference. So underserved populations is huge. The people that applied to the Arizona school, if you have two different people, if you have somebody who has like a 3.6 GPA, 3.65 science, 20 DAT, 100 hours of community service. When I say community service, I mean service that directly impacts an underserved population in some way. Could be dental related, or could be just anything. It could be working at a soup kitchen. Could be working at a free club. Could be Big Brothers Big Sisters. Something where you're actually helping somebody. And this person has 100 hours of that. Person number 2 has a 3.5 GPA. Okay, it's lower. 3.54 science, still lower. 18 DAT, lower, but has like 500 or 600 hours of community service. This is the person we're going to take. Because that's where our heart is. That's where our focus is. That's what we want to do. That's the impact we want to have. And we're going to make sure both people are qualified. But we want the person who has the heart for the underserved population. And these are the admissions requirements, very standard that you're going to see here. Biology, general chem, organic chem, physics. Those are all 1 year with lecture and lab. Biochemistry, physiology, and English, one class. So DAT has to be taken within 3 years of application, as well as it must be a USA DAT. I've got a lot of calls from Canada in the past 4 or 5 months asking me if we will accept the Canadian DAT. I don't think it's a problem for you all, but no, we won't. Letters of recommendation. There are 2 things in your ADSAS application, which is you all know what ADSAS is. The Missouri School of Dentistry and Oral Health is on ADSAS, as well as our Arizona school. There are 2 things on that application that I see that are not black and white. Your grades are black and white. Pretty much what you've done. Volunteer shadowing, that's black and white. Letters of recommendation and personal statement are the 2 things that are not black and white. That really I get to see in full color, if that makes sense. So, letters of recommendation. Require 2. You can have more. One from a dentist that you shadowed, and then one from someone you received a grade from. Committee letter or just professor. It's really important that you get good letters of recommendation. I was going over a medical file the other day, and everything was great. File looked great. Was lining up. But I get to one of the letters of recommendation, and it flat out says, I cannot recommend the student. If the professor does not recommend the student, there's no way that I can recommend the student. I think that he couldn't recommend the student because he didn't know the student well enough. There are some classes, I don't know how it is here at Fort Hays, but there are some classes that are really big. And if you cannot interact with the professor, if all you do is go to class and sit in the back, never interact, never participate, and you still get an A, that's not a good professor to ask for a letter of recommendation. You need to have somebody who you talk to, who you went to their office. It's okay if they've seen you struggle a little bit, as long as they've seen you overcome that. It speaks of your character. I would recommend having at least 2 classes with this person, so they can really see you cross a couple of different classes. It's really important that they can speak to your strengths. So, as well as the dentist, that's huge as well. Clinical exposure, we see about 100 hours shadowing for a dentist. I would recommend that you don't do all of your shadowing with one dentist if you can help it. I would recommend going across different areas. So maybe a pediatric dentist, maybe family practice, maybe periodontics, things like that, just so you get the exposure. And some people say, why do you want us to shadow at least 100 hours? Now, more is more competitive. Okay, if you can get 2 or 3, that's great. The reason is it gives you an exposure to the field. Because some people go in and they think, well, you know, this is going to be, they have this different view of what the profession is rather than what it really is. Being a dentist is hard work, you know, and people need to understand that before they go into the program. For example, and this goes back to the medical side as well, but that's what we know right now in Missouri before we get to dental school. We had our first years just come in not too long ago, and we have a class of 172. We had everybody there. We were going through white coat ceremony. It was exciting. We had one person that doesn't show up. They got accepted, but the pressure was too much because they knew what it was going to be like. The coursework. They weren't prepared. And so we want you to be prepared and have an idea for what you're getting yourself into. This is what I've talked about through working with underserved populations. We see in Arizona an average of 500 hours of that. That's Arizona. I don't know what Missouri's going to bring. We want that because it speaks to the students' dedication to public health and underserved populations. That's our focus, so we want to see it line up. Not saying we're going to see 500 hours. I don't know what we're going to see, but it's important to have that. Extracurriculars, involvement in clubs like this. You know, anything you've done with leadership, anything that you've been a part of, that can speak to your service in that area are important as well. So I was just at a fair in Kearney, and I had a student or 2 come up, and he said, well, how much is the program? And I kind of told him, and is that per year or is that the whole thing? And I told them, and they said, well, how do you pay for that? And believe it or not, most people pay through loans like you do as an undergrad. Most of it's federal loans. And we have a great staff that helps everybody that comes in get everything lined out the way it should be. So most of it is federal loans. There is the military HPSP award. This is where you can go through the military route. It's very competitive. Different branches offer different scholarships, but they usually pay for everything. Then you have to give your time of service. So some people really go for that. Some people don't. Indian Health Services, that's for mainly Arizona. WICHE, that is basically West Coast students. Get some breaks sometimes, but for the most part, it is federal loans. This is our class of 2016 in Arizona. You can see how many people applied and how many people were interviewed. Now, some people look at that and they'll say, wow, that's low. That's low. What's the deal with that? It goes back to what I said before. We have over 3,000 people applying. We're getting people with 3 9s, 3 9 5s. But we're looking for the heart. We're looking for people that have that commitment to what we're trying to promote, what we're trying to do. We're trying to produce people that will go out and make a difference. And we recognize that people aren't the sum of their GPAs and a DAT score. We want those to be competitive, obviously. But 18.54 DAT was the average in 2016. This is just a little bit on the Arizona side. Are any of you interested in the Arizona school at all? Okay, well, I'll just touch on it briefly. The campus is in Mesa. Mesa is a suburb of Phoenix. Very pretty. Like I said, I was there. About 45 minutes from Phoenix, so a lot to do. Missouri, and our Missouri campus, I'll be honest, it's going to be rural. It's going to be, hometown feel, which I like. It's going to be parades and things like that, and fairs and stuff. Mesa is going to be the exact opposite. Fine dining, you've got all the things you'd ever want in a big city life. Keep in mind, as a dental student, which is extremely rigorous, extremely tough, that you want to limit your distractions. Not saying that you don't want to apply it to Arizona, but you want to limit your distractions. Wellness, we have the best YMCA in the country attached to our school. It is really, really nice. Really, really amazing. Like 3 levels. All the students have access to it. And we have it in Arizona, we have like 18 different programs. I said PT, PA, dental, medical as well. And so I was actually there, and I got a pass, and I was going to work out. And one of the PA students is like, "Hey, what program are you in?" But of course, Valley of the Sun, again, extremely pretty and nice, very nice. Right? It's a lot nicer weather there right now than this here, unfortunately. So these are pictures of what the school is going to look like. And actually, they have got the frame up, so you can kind of see the curviness of it now. There for a long time, I was looking, and they were tearing up the parking lot, and not really seeing anything, and then I see maybe there's some concrete that's being laid, but now I'm starting to see it. It's coming across, so it's really neat to see it happen. I actually had to get my parking space so they could go right, but that's okay. It's all right. So obviously, excuse me, we are going through accreditation. CODA is the accreditation body that accredits all dental schools in the United States, and the way this works is you have 2 sides. You have CODA over here, and you have us. And they know we're going to build this school, which we are building. And so they want plans. How is the curriculum going to pan out? What are your rotations going to look like? What's St. Louis going to look like? Things like that. So we come up with this big packet. We send it to them. They look at it. A little bit later, they say, well, this looks good. There's a couple things we want you to tell us more about. They send it back. So it's in that stage where it's going back and forth. And the next step will be a site visit. Once we get everything ironed out, the site visit will come. We will receive after the site visit, and they go back and deliberate initial accreditation. So the way that all new schools work, the school will have initial accreditation until the first class graduates. Then they will receive full accreditation. The students they're going through will be accredited. It's the way through any school, medical, dental, whatever. That's just the way the process is. So we are not going to open our doors if we're not accredited. So we're making sure and you wouldn't want us to do that. You wouldn't want to go to a school that didn't have that ironed out. So that's enough on that. Interprofessional Education Center, that's actually what this name is going to be. It is a dental school, but there are some possibilities that we're working on right now that some medical students, the medical students and the dental students will have some classes together. Basic science classes that they can go both ways. So you might actually have some classes with medical students, which I think would be nice from a networking standpoint.